All right, well, hey there, I'm Dr. Hagmeyer, and I want to welcome back to part 2 of this video series on GERD and acid reflux. Now, if you or a loved one is really tired of dealing with acid reflux and GERD, and you want to learn about some of the root causes behind your symptoms, be sure to check out part 1 that I did in this video series, because today, part 2, we're going to cover, and I'm going to share with you 7 natural tips and treatment strategies that can just naturally bring relief without causing the side effects that proton pump inhibitors or antihistamines, H2 blockers cause. So again, be sure that you watch both part 1 and part 2 of this series together, right? So today, let me give you 7 or 8 things that I promise you are gonna help improve your acid reflux and GERD. I know that there are probably many other things that will help, and if there are things that you found to be helpful as you watch today's video, and you found those things to be helpful for you, share those in the comment section below for other viewers who may be watching this video as well. So number 1 is my golden rule when it comes to the treatment and correction of a problem is always, always, always test, right? Like I discussed in the past in part 1 of the video series, is that there can be several reasons, there's several causes behind your GERD and acid reflux. And when it comes to treatment, you want to be as obviously precise and personal as you can be, because if you can't fix something if you don't know what's causing it. That's the golden rule, right? It's impossible to fix something if you don't know what's causing it. So if you took 3 patients who suffer with symptoms of acid reflux and GERD, let's say patient number 1 might have small intestinal bacterial overgrowth or SIBO and food sensitivities. Patient number 2 might have thyroid disease or autoimmune thyroid disease, Hashimoto's. And a third patient, they might have just a terrible diet where he or she drinks too much alcohol at night and smokes too many packs of cigarettes a day, and again, experiences all kinds of stress. Again, the treatment for all 3 patients obviously has to be tailored to what's causing that patient's problem, or what's causing the patient's acid reflux in this case. It's not simple as just take an acid block medication or a histamine blocker to fix the problem. There's much more to this picture, right? So again, this is why it's so important to be under the care of a doctor who focuses in on functional medicine, what we call root cause medicine. All right, now with that being said, let's jump into some of the lifestyle and dietary strategies and supplements that you can start implementing that can help address these symptoms and provide you some relief. So number 1 is an elimination diet. An elimination diet is very important. It helps identify any food triggers or even some food allergies. Many times foods like chocolate, coffee, eggs, wheat, corn, soy, dairy, nuts, tomatoes, these can all be upsetting to the digestive system. And in some cases, if you're dealing with a food irritant, eliminating that food might be all you need to do, all right? The underlying causes of bacterial overgrowth, on the other hand, again, bacteria in the upper part of the intestines like SIBO, in addition to eliminating common food triggers, you may need to follow something called a low FODMAP diet, FODMAP. Now, I've got a lot of information on my website about low FODMAP diets. Again, talks about this, and there's also a free guide that you can download from my website. I also have a SIBO quiz on my website that you can take to assess your risk for that bacterial overgrowth. But a common approach to identify your problems, food triggers, is of course to keep a food diary of what and when you eat, and of course how you feel. Now, a food diary holds you accountable for what goes into your mouth. Obviously, people often think that they're eating so much healthier than they actually are, and then they start logging what goes into their body and how they feel, and you start to quickly realize that I'm not eating as good as I thought, right? So if you need food sensitivity testing or you need help with getting tested for food sensitivities, just reach out to my office, shoot us a quick email. Number 2 is an anti-inflammatory diet, right? In addition to eliminating common food allergies, following an anti-inflammatory diet like a paleo diet is, again, just tremendously beneficial in treating and preventing acid reflux and chronic inflammation. The foods you eat can either cause inflammation, or the foods you eat can be pro-inflammatory or fight inflammation, right? Fruits and vegetables have color. So again, when it comes to foods can be loaded with antioxidants if we're eating the right kinds, and polyphenols. These again are all superfoods. Foods you want to avoid are things like trans fats, things that say hydrogenated or partially hydrogenated. Again, the important thing to remember is that avoid processed foods, refined sugars, high-fat diets, low-fiber diets. These are all things that don't help gut health. Number 3 is slow down when you eat. I know that sounds so silly, but we are all guilty of this with the exception of my son. My son takes absolutely forever to eat. Everyone is done eating for about 15 minutes. We're all looking and staring at each other, and my dear son hasn't even taken 2 bites of his food. Right? Here's the thing. When you eat too quickly or while you're working, answering phones, or in the car, or going to a meeting, or wherever you're going, your body just doesn't have that chance to break down your food before it gets digested and gets into the intestines. And as I've talked about in past digestion and motility videos, healthy digestion and motility is dependent upon your parasympathetic nervous system. Very important. That's the rest and digest part of the nervous system that really regulates all aspects of digestion, enzyme production, enzyme secretion. It's the brain-gut connection. So if you're under stress, that fight or flight portion of the nervous system becomes activated, and this brings your digestion to a grinding halt. Now, if you can relate to the effects of stress on your life, there are hormones like cortisol and adrenaline, and even neurotransmitters for that matter, like serotonin and 5-HTP, that can be evaluated to determine if stress and neurotransmitters is a contributing part to your motility disorder. Number 4 is start using DGL, deglycerized licorice. Again, this is a medicinal herb. It helps ease acid reflux symptoms. Studies on DGL prove what functional medicine doctors have known for a long time, and that is that DGL helps protect and promote healthy mucus activity. Mucus is one of the keys to good gut health, right? This extra mucus acts as a physical barrier to acid in the stomach and the esophagus, but this barrier is also an immunological barrier where high levels of secretory IgA are present, and that helps your immune system fight off invaders. It's a defense mechanism, right, against bacteria. Support your gut barrier with DGL can help heal the damaged tissues and prevent future occurrences of acid reflux. Again, studies show that DGL was more effective than acid blocking medications. So I highly recommend DGL for anyone with acid reflux or things like gastritis. Mastic gum. Mastic gum is a resin collected from the mastic tree, which again is a native tree to the Mediterranean region. It's been used for its medicinal properties really for thousands and thousands of years, particularly for the purpose of treating digestive disorders. Mastic gum has been shown to have, again, powerful antibacterial properties where it's particularly helpful against H. pylori, again, which is one of the most common bacteria known to cause acid reflux and gastritis, which then, if not corrected, can lead to stomach cancer. Mastic gum works by disrupting the bacterial cell membrane and inhibits its ability to replicate and spread. Mastic gum's also been shown to reduce inflammation in the gut and digestive system and promote the healing of ulcers. One study looked at 148 patients who had acid reflux and gastritis, and they were all given mastic gum 3 times a day for 3 weeks, and 77% reported significant improvement. Less heartburn, less abdominal pain, less stomach pain. These things all improved in the mastic gum group, where it did not improve in the placebo group. Like I said, when it comes to mastic gum, I love it when it's combined with zinc carnosine, and that's because zinc carnosine is known to help inflamed, irritated tissues, also helps support a leaky gut when that exists. Number 6 is learn more about the iliacecal valve and the lower esophageal sphincter. Now, I've done a few videos on both of these. The powerful video that explains the role of the lower esophageal sphincter as well as the iliacecal valve, why they're important in preventing bacterial overgrowth. There's also a video I did on a massage technique known as the iliacecal valve release technique. This technique is very, very helpful for people with GERD and acid reflux and SIBO and many other motility disorders. And last on my list, number 7, is work with a functional medicine doctor. A doctor who practices functional medicine is root cause. This is true healthcare. It goes way beyond just treating symptoms because the focus is really on understanding the cause of your symptoms, the why of it, if you will. Conventional medicine is, for the most part, not personalized to the individual. They don't run the kinds of tests that functional medicine doctors do. Most conventional doctors are great at treating symptoms, great at prescribing, antacids and proton pump inhibitors, but they're not going to talk to you about diet. They're not going to uncover why you have the symptoms that you do. They're not going to check to find out why the symptoms continue to come back. And ignoring the root cause, if you do it long enough, eventually just snowballs into more serious health problems. Again, the reason why functional medicine has exploded comes down to the fact that a functional medicine doctor who's certified and has experience and is trained looks at several other aspects and areas of your health. And so there you go. I hope you enjoyed today's video series and I hope you learned a few new things. And if you like today's video, there's over 200 videos, 200 plus videos actually now on my channel that deal with many other chronic health problems that you or a loved one might be suffering with. You might find some great videos to help you in your journey to recover your health. Like I said in the beginning of the video, don't forget to go back and watch part 1 of this video series where I go through, again, the different causes of why you have GERD or acid reflux or heartburn. Okay, well, there you go. Take care.